Welcome to Health and Wellness Training. To get started, please make sure that you have a training experience report form. Get that out and start filling in your name and the date at the top. And then towards the middle of the page, you'll want to put the start time of the training, and please make sure you include AM or PM. And we will get started with the training.
The training objectives for today include universal precautions, personal care, safety during emergencies, positive behavioral supports, maintaining a safe environment, nutrition and wellness, vehicle safety, safety during lifting and transferring, diet and related health issues.
An important part of your role as a staff member is to make sure that your participants you support are as healthy and safe as possible. Your responsibilities will depend on the area in which you work. For instance, staff who support participants in day services play a vital role in carefully observing individuals and in reporting any changes in their behavior, appearance, or eating habits that may relate to good health.
Some things that you can be on the lookout for with participants are changes in daily patterns. These changes can include things like a decrease in appetite or difficulty digesting food, increased sleeping or inability to sleep, pain associated with an injury or illness, and medication changes and reactions. Other things that you can be on the lookout for are changes in appearance. Those things can include weight gain or weight loss. You can observe the condition of their skin, such as it being too pale or more sweaty than usual, and hair. You can also look out for eyes appearing watery and itchy and red, skin swelling and redness, and hygiene deterioration, such as body odor, untidy clothing, and bad breath. A few more things to be on the lookout for include changes in bodily functions. So this can include changes in breathing, balance or dizziness, pulse and blood pressure, bowel movements and bladder control, and any changes in the use of their limbs, such as their hands, arms, and legs. Another area that you could see changes in is behavior. Perhaps you've observed a change in their mood. Maybe they're more depressed than they were before, or maybe you've observed agitation or crying. Combativeness and argumentativeness, withdrawn, being anxious and restless, and observe changes in someone that are just different than normal. So for example, maybe before they were an energetic person, but now they appear to be quiet and don't talk.
Most of you in today's training are considered direct support staff. Examples of a direct support staff include a production supervisor, a living skills instructor, a transportation driver. Let's look at what is a direct support staff. Direct support staff are people who work directly with individuals with developmental, physical, and/or mental health disabilities. These staff members support people with disabilities to lead the life they want to lead through their day-to-day activities. This includes supporting them to complete daily living skills and to participate in and contribute to the community. They provide supports to participants at home, work, school, places of worship, and many other environments. These staff members advocate for the person that they support by helping them to communicate their needs, feelings, and goals. As a direct support staff, you may have many different responsibilities, which include personal care, such as dressing, toileting, and feeding. These activities are very important and unique for each individual. When assisting individuals with personal care, you should be especially mindful of professional ethics. You will want to apply your professional ethics every time you assist and support an individual with personal care skills. These ethics should include respect. Personal care should be provided with dignity and respect for the participant. Promoting physical and emotional well-being. Personal care should be provided safely in a way that promotes the physical and emotional well-being of the participant while reducing the risk of harm. Confidentiality. A participant has the legal right to have his or her support needs kept confidential and to privacy for personal care. Responsibility. Participants should be supported in doing as much for themselves as possible. And finally, self-determination. Participants have the right to direct how personal care is provided. Part of your job is to support participants so that they can be more independent. Depending on the abilities and preferences of each participant, you will need to provide more or less support based on their individualized support plan.
In our jobs, oftentimes we have personal care for our participants in their daily living skills. Some of these that we consider are their basic self-care tasks. They include their ability to dress, eat, walk and transfer, using the restroom, taking care of their personal hygienes. These activities are so important for the participant to function, and as staff, you'll find yourself having to assist with some of these tasks.
One personal care thing that you may assist participants with is assisting them with toileting. You may assist people with elimination of their bodily waste. In this role, you will need to understand that safety of the participant and preserving their dignity are of the utmost importance. When assisting the participant with this bodily function, you should promote independence as much as possible, because this will allow for greater privacy. However, never leave someone who needs assistance on the toilet outside of your range of hearing. If the participant should fall or require your help, there would be no way of you knowing. You should become familiar with any adaptive equipment that the participant you are supporting uses. You should learn about these items beforehand and become comfortable with using them so you know how to use them when it's needed. Make sure to follow good hygiene techniques. As always, wear gloves during assistance with toileting. Make sure to wash your hands before and after assisting with toileting. It may also be helpful to have a supply of moist, flushable wipes for use after a bowel movement. When soiling occurs, make sure that the participant is cleaned and that their clothes are changed as soon as possible. Never check inside their underwear to check for soiling.
Direct care staff may also need to help participants at meal times. Whenever possible, the participant should eat with the minimum amount of assistance necessary. If needed, adaptive equipment should be available to the person to encourage self-feeding. Feed a person only if he or she is unable to do so. Keep the following guidelines in mind. Wash your hands. Be aware of food temperatures. Allow adequate time for eating. Do not rush. Interact in a pleasant and appropriate manner. Feed with small bites. A maximum of 1/2 of the spoonful at a time. Begin the meal with something the individual likes the most. Alternate between solids and liquids unless the person prefers otherwise. Do not force the spoon into the individual's mouth. Wait a couple of seconds before removing the spoon. Don't use the participant's teeth and gums to scrape the food off the spoon or scrape food off of the participant's lips, cheek, or chin with the spoon. Use a napkin. Don't pinch anyone's nose shut to get them to open their mouth. Never feed anyone nor let them feed themselves while they are in restraints. Follow any specialized feeding programs as written. Please be aware of your participant's high-risk plan. Ask for additional training if you are unfamiliar with the feeding program techniques listed for the participant.
Health and safety. What's your role? Know the safety needs for the participant that you support. It's a good idea to learn each person's needs regarding safety. It could be in such specifics as in their mobility, their vision, and hearing. Also, we'd want you to know the medical and social history for the individual. What is their special diet and why do they have that? Who has food allergies or other allergies and what are they? Make sure that you know where this information is located. Familiarize yourself with all participants and their high-risk plans. That's done annually and taught by this department. Help participants find fun ways to get up and moving. Being active benefits our well-being, and just walking 30 minutes several times a week can help us both, participant and staff, physically and psychologically.
There are 4 major health issues that are more common in people with developmental disabilities than people in the general population. These 4 major health issues can lead to severe illnesses and even cause death. They are frequently referred to as the fatal 4. These 4 things include aspiration, dehydration, constipation, and epilepsy or seizure disorders. Aspiration, dehydration, and constipation may be dangerous conditions that often go unrecognized. Many of the symptoms are subtle, and persons with developmental disabilities may not be able to express their discomfort or give indications that they are not feeling well.
Let's look at dysphagia and aspiration. Dysphagia is the medical term which means difficulty swallowing. Aspiration is when bits of food, fluid, saliva, or other materials are inhaled into the lungs. Aspiration often happens as a consequence of dysphagia. These 2 important medical problems are often not recognized promptly in people with developmental disabilities. There are factors that place individuals at risk for aspiration, and they include being fed by others, inadequately trained caregivers assisting with eating and drinking, weak or absent coughing, gagging reflexes, commonly seen in persons who have cerebral palsy or muscular dystrophy, poor chewing or swallowing skills, GERD, which can cause aspiration of stomach contents, food stuffing, rapid eating and drinking, and pulling of food in the mouth, inappropriate fluid consistency and or food textures, medication side effects that cause drowsiness, and relaxed muscles causing delayed swallowing and suppression of gag and cough reflexes, impaired mobility that may leave individuals unable to sit upright while eating, and epileptic seizures that may occur during oral intake or failure to position a person on their side after a seizure, allowing oral secretions to enter the airway.
Mealtime behaviors that may indicate aspiration could be unusually eating slowly, or the fear and reluctance to eat. Could be coughing or choking during meals. Maybe refusing foods and or fluids. Food and fluid falling out of the person's mouth. Eating in odd or unusual positions, such as their head back when swallowing or swallowing large amounts of food rapidly. Or even refusing to eat from a favorite caregiver.
If anyone has a history of aspiration, some interventions that could be used to try to prevent aspiration in the future include the following: a chin down position, because this position helps to make the liquids not go to the lungs. You could use nectar-thickened liquids, honey-thickened liquids, and pudding-thickened liquids. Someone could also be on a mechanical soft diet or a pureed diet. If anybody has any of these interventions in their high-risk plans, it could indicate that they are at risk for aspiration. Aspiration is generally diagnosed with a swallow study, but you can find this information on a high-risk plan.
Another major health issue that is common in individuals with developmental disabilities is constipation. Constipation is when an individual has difficulty passing stool. The stools are hard, dry, and often look like marbles. The frequency of bowel movements varies greatly from person to person. Bowel movements are considered normal as long as the feces is soft, normal-sized, and is passed easily out of the bowel. Some of the factors that place individuals at risk for constipation include neuromuscular degenerative disorders that impair the central nervous system's response for the need to eliminate, spinal cord injuries or birth defects that affect neural responses needed for elimination, such as spina bifida. Individuals with muscle weakness who lack the strength and tone needed for adequate bowel function. Diets that do not contain enough fiber and fluids. Poor swallowing skills with aspiration risk, making it difficult to eat and drink adequate amounts of fiber and fluid. And inadequate or inconvenient access to the bathroom.
Let's continue with more factors that may place an individual at risk for constipation. This could include immobility and poor body alignment that does not allow for optimum positioning for bowel elimination. It could be poor bathroom habits or routines or lack of privacy and time for using the bathroom. It could be medications. It could be hemorrhoids or other conditions that make bowel elimination painful, or possibly the frequent use of laxatives that may lead to decreased bowel reactivity. It could be the repression of the urge to defecate due to psychiatric or behavioral issues.
Next, we want to talk about some signs and symptoms of constipation. So how do we know that someone might be constipated? Perhaps they're spending a lot of time on the toilet. If you notice straining and grunting while passing stool, maybe they're refusing to eat or drink. Hard, small, and dry feces could be an indicator of constipation. Bloating and complaints of stomach discomfort. If they have a hard, protruding abdomen, they could be constipated, and this could be an emergency. And if they're vomiting digested food that smells like feces, this is an emergency, and they should seek emergency help. Some interventions for constipation can include consulting a dietitian to talk about their diet, because maybe there are some things in their diet that they could change to help the constipation. So for example, perhaps they could increase their fiber intake. And another idea is that we could come up with a high-risk plan for them to perhaps get some Miralax or something in their diet to address the constipation. But please refer to the individual's high-risk plans to determine what you should do if you have a participant that's diagnosed with constipation.
The third major health issue that is common with individuals with developmental disabilities is dehydration. Dehydration can occur when an individual does not drink enough fluids. Fluids are needed for temperature control, chemical balance, and for cells to make energy and get rid of waste products. Dehydration occurs when the body loses more fluid than is replaced. Factors that place individuals at risk for dehydration include the individual is unable to access fluid without assistance. They need assistance with drinking, dysphagia with coughing and choking during meals, food, fluid, and saliva falling out of a person's mouth. The individual frequently refuses food and fluids. Suppression of thirst mechanism that results in the inability to recognize thirst. The individual is unable to effectively communicate thirst to their caregiver. Medical conditions where fluid loss can potentially cause dehydration, such as a kidney disease or diabetes. Conditions where the individual loses body fluids, such as drooling, diarrhea, sweating, and vomiting. And finally, taking medications that affect body fluid balance, such as a diuretic.
Signs and symptoms that an individual may be dehydrated could be dry skin and poor skin elasticity, extreme thirst, dry sticky mucus, lethargy and decreased alertness, fever, increased heart rate and decreased blood pressure, decreased urination, dark colored urine and concentrated urine smell. Some interventions for dehydrations: offer fluid intake if the individual is alert and able to drink safely. If they're unable to drink safely, call healthcare professionals for administration of intravenous fluids. 911.
The last of the final four, or major health concerns for those with disabilities, is epilepsy or seizure disorders. Epilepsy is a disorder of the brain that is characterized by recurring seizures. Individuals with developmental disabilities are more likely to have epilepsy because of an underlying brain dysfunction. Some causes of epilepsy include head injuries, brain tumors, and brain congenital abnormalities. Seizures that start in different areas of the brain could look different for different participants. Factors that place individuals at risk for epilepsy include prenatal and postnatal brain injury, such as trauma, an infection, congenital brain malformations, brain tumors, clots, hemorrhages, and aneurysms, and lastly, traumatic brain injuries. And now we're going to watch a brief video that talks more in depth about seizures and how to assist someone that has seizures.
Now let us look at some ways that we can maintain a safe environment. Safety means doing things in a correct and careful manner in order to have an environment that is free of danger and hazards. But hazards happen, don't they? Is there some ways to prevent them? As a direct support staff, you can prevent accidents and, if they do occur, respond to them in a way that reduces injury to both you and the participant. The following are some basic practices that reduce the risk of injury to participants and staff. These include know the Shares Incorporated safety policy. We should keep medications and dangerous substances in locked cabinets or containers. Have good lighting. Provide enough space for people to move around freely and without clutter. Remove any tripping hazards. Practice proper body mechanics when lifting. Assist with proper wheelchair handling. Share information about hazards. Know and practice emergency response plans. Know first aid. Know CPR. Limit distractions, including texting and cell phone use while working. Focus on the individuals you support and what is happening in the environment.
One way we maintain a safe environment is by using universal precautions. Universal precautions are infection control procedures, and you probably already use them in everyday life. We wash our hands properly, we keep our work environment clean, we use personal protective equipment such as gloves. Universal precautions are designed to prevent staff from transferring infections to themselves and others, as disease-causing agents may be present in body substances, even when a person does not look or act sick. These universal precautions should be used whenever you come into contact with body fluids from any other person.
You might be asking yourself, what is the purpose of using universal precautions? The purpose of using them is to prevent or minimize exposure to bloodborne pathogens. To be safe, universal precautions apply to any fluid that is emitted from the body. You should approach all participants as if they have an infectious disease. Universal precautions applies to tissues, blood, and other bodily fluids that may contain any blood. Blood is the most common source of HIV, hepatitis B, and other bloodborne pathogens in the workplace. Plan ahead when you are working with a participant and make sure that you're using the appropriate personal protective equipment, such as gloves. Know the limits of the PPE that you're using and what equipment can protect you and when it cannot protect you.
A few more highlights in regard to universal precautions are: do not recap needles. Always place contaminated sharps in the puncture-resistant container. Wash your hands immediately after contamination and when removing gloves. Yearly training in bloodborne pathogen is required by Shares Incorporated.
Let's take a look at a short video involved washing your hands.
Moving right along in our training, the next topic that we would like to discuss is safety during emergencies. Shares Inc. has monthly safety drills that are practiced in each facility. During this time, we will practice the drill of the month, which we'll talk about in the next few slides, and then as a group, we meet to discuss safety issues. All staff are trained in first aid and CPR prior to supporting participants alone. This enables you to react appropriately and to possibly save someone's life. All emergency phone numbers should be posted by the phones that you find throughout the building.
One of our monthly safety drills is for fires. Shares has an emergency action plan that addresses fire. Number 1, the person discovering the fire will sound or pull the nearest fire alarm. In the facilities where the alarm does not ring directly into the fire department, the staff in charge of the program area will call the fire department. 2, notification of the administrative office shall immediately follow the contact of the fire department. 3, all other staff shall assist program participants, visitors, etc. to leave the building following the proper posted routes. 4, as evacuating, all staff will stop air movement by closing all doors and windows. Turn off fans or air conditioning blowers in the area of the fire. Turn off all lights and equipment. Each staff is responsible for their respective area. 5, staff shall direct all employees to designated areas outside the facility and take attendance. And finally, 6, if appropriate, staff shall use proper equipment to fight the fire. Posted signs pinpoint locations of fire extinguishers.
We also have an action plan that addresses bomb threats. In the event of a bomb threat, the building will be evacuated by the same procedure as in case of a fire, following the emergency evacuation plan that is posted. Except, evacuated persons shall be removed to a distance of no less than 75 yards, pending the arrival of safety personnel. Secondly, the police shall also be notified of the situation as soon as possible. And third, re-entry to the building shall come only after clearance by appropriate authorities.
Another emergency action plan that we have a plan for is for when there is a tornado. When under a tornado warning, staff responsible shall alert all other personnel using the intercom. Staff in each area shall direct employees to the designated area. All doors must be shut and locked if possible and lights turned off. Remember, remain calm. Number 2, once in the designated area, staff are to direct employees to sit with knees bent in front of them, head tucked between the knees, and hands clasped over the head. 3, employees shall be advised against rushing outside where they could be endangered from live electrical wires and flying debris. Number 4, employees shall be kept away from windows, from under lighting fixtures, and away from other locations where they would be subject to flying debris. 5, telephones shall be reserved for emergency use only. Number 6, appropriate agency personnel shall remain in contact with the sheriff, police, civil defense, Red Cross, or others who can provide authentic information as to the storm's progress or can offer rescue assistance. 7, designate someone who is calm and capable to remain with any person who is unduly excited or hysterical. Number 8, be alert for fires caused by broken electrical circuits. 9, remain in designated area until the warning is lifted. And finally, paramount is the ability to remain calm. This will do much to provide reassurance to our employees.
The next emergency action plan is for power failure. During a power failure, appropriate steps will be taken by authorized personnel to notify the utility company of the failure. Staff will instruct employees to remain at their workstations and to stay calm. Depending on weather conditions, etc., the general manager will make the decision to relocate or close the program.
And another emergency action plan are earthquakes. Earthquakes usually occur without any type of warning. Due to the suddenness, staff should direct all employees to get under a table and attempt to get those in wheelchairs into a doorway passage. Any place where a staff member feels an employee is safe is warranted. No one should go outside the building. After the earthquake is stopped, the following procedures should be initiated. First, all employees should help to restore calm to fellow employees. Secondly, production supervisors should account for all employees in their area, check for injuries, and provide first aid as needed. Thirdly, plant manager and production supervisors should check for fires and shut off all gas, electricity, and water at main controls. 4. Plant manager shall inspect the building for damage. If major structural damage has occurred, the plant manager shall order a complete evacuation. 5th, plant managers should notify proper utility companies or other services as needed.
Next, we'll talk about the plan for emergency backup alerts. In the event of an emergency in which employees could not be alerted by standard means, which would be an alarm or an intercom, the following backup procedures shall be followed. A whistle shall be available at each facility in a centrally located, easy accessible place. All staff shall be aware of the location. Staff alerted to the emergency shall blow the whistle to get the attention of the employees. This staff member shall then explain the emergency and what needs to be done. Staff alerted to the emergency will instruct another staff to go and inform other areas of the emergency situation. Once employees have been alerted, standard procedures specific to the emergency apply.
We also have an emergency action plan for medical, dental, and health emergencies. Each program area shall have appropriate emergency numbers posted at each telephone. 911 will cover fire department, police department, and ambulance. A number for poison control shall also be listed as well. Each program area shall have immediately available a list of employees with individually appropriate emergency information and phone numbers. This information can be found on our face sheets. In the case of a medical, dental, or health emergency, the employee will be administered emergency first aid as needed by a staff member trained in first aid. And finally, if the emergency is such that further treatment is required by a physician, the procedure for referral of employee to a physician of emergency care facility when further medical first aid treatment is required shall be followed.
Let's see what to do in the case of a missing person. First of all staff for keeping attendance shall check attendance within 15 minutes after appointed arrival time. Immediately following each break and lunch, the responsible staff shall check again the attendance. If an employee is missing, this staff member must immediately determine the whereabouts of that employee. The staff in charge of the program area shall immediately search the exterior of the building, while another staff member is checking the interior. If the employee is still missing, the program staff in charge shall notify and seek attendance from all and any other of the following is necessary: Sheriff's Lake Administrator, Parent Guardian of the employee, Residential Facility of the employee, Police, and Sheriff. The same procedures in numbers 2 and 3 shall be followed if the client is missing from a Shares Inc. sponsored activity that is taken outside of the program area. Follow along will be provided by Shares Inc. Social Service Department, and counseling will be provided as is necessary.
We also have a plan for violence and other threatening acts. If this were to occur, the following guidelines are to be followed. The procedure cannot cover all potential acts of violence. Each event will dictate its own course of action. These acts include explosions, gas leaks, biochemical threats, acts of terrorism, and the use of weapons. The safety and health of all consumers and staff should be first priority. Notify all personnel via the paging system or by voice that a code red exists in what part of the facility. For example, code red in the front office, explosion. Upon hearing code red, any staff should immediately call 911. Describe to the dispatcher the nature of the call, name of the business, address, and ask for advice. The plant manager or appropriate personnel should take charge of the situation and provide a safe environment for consumers and staff. This could mean evacuation and/or relocation to a secondary site specific to each facility. In the case of evacuation, all personnel should follow the evacuation maps located throughout the facility. The plant manager or appropriate personnel should follow the instructions of responding emergency agency. In the case of injuries, emergency first aid should be administered until medical professionals are arriving on site.
The final emergency action plan is for carbon monoxide. Carbon monoxide is a toxic gas produced by the incomplete combustion of fuels. Since you cannot see or smell carbon monoxide, it can't be detected without the help of a carbon monoxide detector. Injury is due to the combining of carbon monoxide with the hemoglobin in the blood. This lowers the oxygen carrying capacity of the blood, also known as oxygen starvation. The early symptoms of carbon monoxide poisoning are often ignored because they are mistaken for the flu. They include the following. For a mild exposure, you may see nausea, headache, ringing in the ears, fatigue. For a medium exposure, you may see severe headache, drowsiness, confusion, fast heart rate. And then for extreme exposure, you may see unconsciousness, convulsions, cardiorespiratory failure, and even death. Carbon monoxide detectors have been installed in all of our buildings. The detectors have been placed in strategic locations so they will detect carbon monoxide from various possible sources such as heating system failure, truck and auto exhaust, water heaters, blocked chimneys or flue, downdraft problems caused by wind conditions, or flue problems. The carbon monoxide detector works like a smoke detector and plugs into the wall. Once it is plugged in, the carbon monoxide sensor continuously monitors the air. If the carbon monoxide concentration nears a harmful level, it will sound an alarm. If you hear the alarm, you should immediately have all people in your area evacuate the building. You should then call the fire department and report the problem. Do not re-enter the building until the fire department has granted permission.
We are now looking at another topic of transfer and lifting. This is the process of lifting and or moving an individual from one location or surface to another, just as from a bed or to a wheelchair or a chair to a vehicle seat, without causing injury or harm to the participant or staff. Did you know lifting and transferring participants is the #1 reported cause of knee, back, and shoulder injury in direct care staff? Unsafe transfers can cause serious, life-threatening injury to the participant and or staff, so always be alert to potential hazards and risks when transferring participants from one location to another, even when it's just repositioning someone.
Some risk factors that can cause injury when transferring and lifting include the following things. Sometimes participants can't cooperate during the transfer or lift. Perhaps they're confused or combative, which would lead to their lack of cooperation. Participants could have impairments. These could include things like being non-weight bearing or partial weight bearing. Sometimes participants are unable to assist during the transfer and lift. Sometimes medications can interfere. Next, staff who are unprepared and not skilled could be a risk factor for injury. This could include being an untrained staff, being unfamiliar with the participant, believing that you're too healthy and fit and that you can't get hurt, and not asking for help. Faulty or damaged equipment could also cause injury, and lack of needed equipment and supplies.
Some strategies that will help decrease injury during transferring and lifting include: provide training to staff responsible for lifts and transfer of participants. Ensure the staff ratio is appropriate to meet the participants' needs. Orient new and existing staff to participants needing transfers and lifts. Provide equipment as needs change, such as lifts, gait belts, and slide boards. Maintain equipment in good working condition. Repair and or replace equipment as needed. Refer back to training and resources regarding use of available equipment. And finally, identify participants at risk for difficult transfers.
We're looking at a chart here concerning transfer and lifts. First of all, let's look at the individual. Are they able to cooperate? Are they able to assist? Can they fully bear their own weight? Can they follow instructions? If not, are you trained and familiar with this individual and their personal transfer needs? I would like to say that if it's yes, then first of all you need to inform the individual of the planned transfer lift. Get the staff together that it's needed if they're able to if they're unable to cooperate or have impairments, and if they need to gather any equipment required by the individual's plan. Complete the transfer or lift. If not, locate the plan and get assistance from staff trained and familiar with the individual. Now, if yes, provide assistance as needed and stand by for safety.
And now we would like to provide you with some safety tips when doing a wheelchair transfer. Apply all brakes and test them. Apply the anti-tip bar if available. Ensure that the chair is secure and does not slide. Make sure the participant is not restrained by a belt and or clothing. Use a gait belt, especially when performing a one-person transfer. Move the participant from a high to a low position whenever possible. Use a Hoyer lift and or 2 or more person lifts when needed. Whenever in doubt, seek assistance or 2-person transfer. Use good body position when assisting with a transfer.
Now we will look at some general guidelines for transferring. While procedures can vary for certain kinds of transfers, there are general guidelines that apply when assisting with any transfer. Explain each step of the transfer and allow the participant to complete it slowly. Verbally instruct the participant on the sequence of the transfer. For example, move to the front of the chair, etc. When assisting in the transfer of a person, do not grab, pull, or lift by the participant's arm or joints, elbows, shoulders, wrists, as they can cause injury. Know your limits. Don't transfer anyone heavier than you can handle. And finally, if the participant is unable to stand or is too weak to stand, you can use a mechanical lift for transfers. If this is not in the service plan or you do not know how to use a mechanical lift, ask your supervisor for instructions on what to do.
Another topic that we want to look at is proper lifting techniques. Obviously, this is a job that requires our backs. We have it in the warehouse, we have it with participants, all sorts of reasons. So injuries can happen just with improper lifting. So before lifting anything, think about the lift. One of the most important things you need to remember is proper planning. Ask yourself, can I lift this safely? Do I need some help? Plan every step before you do it physically. One of the things is get a wide base of support. Your feet should be about shoulder width apart. Bend at your knees, keeping your back straight. Don't turn your body, or do turn your body. Don't twist it. Move your body as a single unit. Make turns with your feet, not your waist. Tighten your abdominal muscles to support your back when you lift. Lift with your legs. Let your powerful leg muscles do the lifting, not your weaker back muscles. Keep the load close to your body. The closer it is to your body, the less force it is on your back.
Another objective that we said we would discuss during this training is nutrition and wellness. Our participants have the same good nutrition and proper weight management as people without disabilities. Since intellectual and other developmental disabilities are often associated with other medical conditions such as epilepsy, allergies, diabetes, and heart problems, you may support people who are required to follow a special diet for health reasons that could include food allergies. You should help monitor participants during meal times and encourage appropriate amounts of food to assist with maintaining good health and nutrition.
Supports that are often needed by our participants include recognizing and responding to any sign or symptom of illness. The participant may need assistance to recognize when a doctor's appointment is needed, and assistance in arranging appointments. Any signs of illness must be reported according to the Shares Incorporated policy. During activities, support the participant in making healthy choices. Support is often needed to recognize if there are activities that may be harmful to their well-being. Staff must do this while being respectful of the participant's individual choice. In regards to their diet, support the participant to recognize which foods cause health issues while again being respectful of their individual choice. It is our job to educate on consequences, but eventually they can make their own choice. When a participant has a specific diet prescribed by a health professional, staff need to support the person to recognize which foods could cause health issues. Again, staff must do this while being respectful of their choice. Staff must understand and follow the prescribed plan with regard to food textures, such as chopped, ground, pureed, blended, thickened liquids, etc. This information can be found in the individual's high-risk plans. When administering medications, support the participant in taking medication by always following the procedures that are taught in medication administration training. When a participant has medication prescribed, Staff need to support the person in taking this medication by following the procedures that are taught in our medication administration training. All staff are required to successfully complete the training yearly, as well as the Core A and B prior to administering medications to any participant.
Another technique we're looking at is positive behavior support. This is person-centered, and it's an approach to address challenging behavior by changing the surroundings and support while teaching the person new skills to better communicate and provide more choice and control over his or her life. Positive support is the preferred approach to ensure participants have supports to be successful. This stresses personal growth, with the end result being an improved quality of life for the participant. Minimizing the challenging behavior is a secondary goal. Shares Inc. has an in-depth training on this topic called Behavior Modification Training by Liz Farmer, Behavior Consultant.
If you remember the behavior modification training that was held, here are your roles in positive behavior support. Be a good role model. Be a good observer. Keep good documentation. Follow the behavior plan that is in place. Do not make up your own behavior plan. Be a good communicator. Be supportive and respectful. Commit to problem solving. Assist participants with improving their quality of life, and point out positive interactions.
The final training objective for today is vehicle safety. Every year, Shares Incorporated hosts RTAP trainings for individuals who have transportation or driving as a responsibility for their job. These trainings go into more in-depth details on passenger assistance, evacuation, and pre-trip inspection. These individuals are required to complete the training at least one time a year. But these are some general guidelines you can follow for vehicle safety. Before you turn the key, be aware of the Shares Inc. transportation policy and follow it at all times. Know your route and plan it out. Ensure vehicle safety by completing the pre-trip inspection form. This needs to be done each time the vehicle is taken out for the first time of the day, and it should be done by the person who is driving the vehicle. Schedule drink and food and bathroom breaks for long trips. Also, allow enough time to cover the route. Have attendance sheets ready for pickup and drop-off.
Here are some things that you should consider as you're loading participants. You should designate a pickup area. You should know your passengers and assist them as they enter the vehicle. Perhaps some of them need assistance with entering the vehicle. Plan accordingly. Perhaps you might plan for behavioral issues, difficulty with change, car sickness, or anxiety as traveling. Ensure adequate staffing to provide oversight during transportation. Ensure enough seating and space for adaptive equipment. Plan the seating arrangements to ensure a safe and pleasant trip. Check seat belts. It's the law. Everyone should have their own seat belt. They should be properly buckled in, and the seat belt should be in good condition. Document each participant on the group and individual transportation logs as they enter the vehicle when they're on the routes. Everyone should do a head count before leaving.
Let us continue and end with this vehicle safety. First of all, unloading participants. Designate a drop-off area. Check off each participant as they exit. Assure safety and assist as needed. Perform a visible check of each seat of everyone that has exited. Never leave a participant in a vehicle unattended. Lock the vehicle to prevent entry while unattended. Now some ideas about wheelchair lifts. Know how to safely operate the lift for the vehicle. Avoid distractions. Pay attention to safety. Perform a visual check of the area before operating the lift. Inform, very important, that you inform the participant of each step to ensure they are prepared. Position the participant and their wheelchair in the middle of the lift platform. Lock the wheelchair brakes while on the lift to prevent rolling and uncontrolled movement. Assure power chairs are turned off while on the lift. Secure each wheelchair in the vehicle using appropriate locking devices, seat belts, tie downs, etc. Do not allow any horseplay on the lift. Use it only for the purpose for which it was designated.
And this concludes our training on health and wellness. Please get out your training form and finish completing it. You'll want to make sure that you put the end time of the training. So look at the clock and write down what time it is. And then make sure that you sign your name and date the form. Once that's done, please turn it in to your service coordinator. Thank you for attending this training.